Hi, I'm Adam White, licensed acupuncturist. Welcome back to the Acupuncture and Herbs podcast. Today, researchers find that acupuncture increases the benefits of drug therapy for the treatment of heart arrhythmias, so things like atrial fibrillation, for example. So arrhythmias can be problematic because they can be a precursor to things like a heart attack and severe heart-related events. So this research was published at healthcmi.com on June 12, 2019. You can go to www.healthcmi.com and look for the article when you click on news entitled Acupuncture Ups Drug Benefits for Heart Arrhythmias to see the details of this research. So what they found is patients taking only drug therapy, and they were taking quite a lot of drug therapy, I might add, the usual host of several different types of arrhythmia drugs, etc., plus blood thinners. If they were only getting drug therapy, they had decent results. But when you added acupuncture into the mix and a little bit of herbal medicine, significantly better results. So that's what we find here. And so what we're suggesting based on the research is that drug therapy is simply not enough. We're not saying that it's not helpful. We're just saying it's not the complete package. And what's interesting about this research is they only added one acupuncture point and a very simple herbal formula. So the one acupuncture point added, which is famous for regulating the heartbeat, is PC6, pericardium 6, Neiguan. And then they added a variation on the herbal formula Zhegan Chao Tang, which is traditionally used for the regulation of the heartbeat. So straight out of the box, textbook acupuncture and herbal medicine, plus straight out of the box drug therapy, including something very potent. People received amiodarone. Now, if you're not familiar with that drug, it can have severe adverse events associated with it. It is a powerful antiarrhythmic drug, but not without side effects. So that is not something you just kind of use lightly. This is a very serious drug. When doctors will use it is to hopefully prevent a problem causing loss of life. Side effects can be severe related events, including problems with the AST and ALT liver levels, headaches, abnormal gait, dizziness, hallucinations, sleep disturbances, sensitivity to light, hypothyroidism. Congestive heart failure is one of the side effects, optic neuritis, corneal microdeposits, polyneuropathy, even cystic fibrosis, problems with the kidneys. So ideally, you wouldn't want to use a drug like that if not necessary. But if you are using it, you might as well get the best out of it. And this research is saying basically use the acupuncture and herbs. In any case, I would deeply suggest working with the cardiac doctor to see if the patient really needs to take that specific drug. Now, in this study, people were taking several things, and it's all listed there, including a beta-1 receptor blocker. But the amiodarone, that's the heavy guns. Now, again, just because I listed off a bunch of serious adverse events doesn't mean it's not a life-saving medication, but it's not without its risks unto itself. So again, something not taken very lightly. The research pretty good. No surprises. This was done at the Qinghai Provincial Hospital of Chinese Medicine in China. And if you go to healthcmi.com and click on news, you're going to find a lot of research confirming this, even from University of California, Irvine. They did a study and finding similar results. Now here they also find that the heart rate variability improved with acupuncture, and pro-inflammatory cytokines and things like this decrease significantly, including important decreases in levels of plasma C-reactive protein, interleukin 8, and tumor necrosis factor alpha. So acupuncture had a definite effect on these serum blood factors, so that's great. And not to be underestimated. So go to healthcmi.com, click on news, and take a look for the article entitled Acupuncture Ups Drug Benefits for Heart Arrhythmias. Thank you for listening. www.healthcmi.com.